It seems you can hardly open a newspaper or browse online without hearing about Ozempic. This medication has become a major topic of conversation, and for good reason. Many people see it as a revolutionary tool for weight loss and managing type 2 diabetes. The stories of dramatic transformations are compelling, making it sound like a true wonder drug. But with all this excitement, it is crucial that we take a balanced look. It is important to understand not just the potential benefits but also the risks involved. This allows us to make informed decisions about our health, which is always the most sensible path. So, what exactly is Ozempic? It is the brand name for a drug called semaglutide. Originally, it was developed and approved to help people with type 2 diabetes control their blood sugar levels. It is an injectable medication, usually taken once a week. The way it works is quite clever. It mimics a natural hormone in our bodies called GLP-1. This hormone plays a key role in our digestive system and appetite regulation. By copying this hormone, Ozempic helps the body release more insulin when blood sugar is high, which is excellent for diabetes management. The mechanism that helps with blood sugar also has other effects, which is why Ozempic has gained so much fame for weight loss. The GLP-1 hormone that Ozempic imitates does more than just manage insulin. It also sends signals to your brain that you are full, which naturally reduces your appetite. On top of that, it slows down the speed at which your stomach empties its contents after a meal. This process, known as delayed gastric emptying, means you feel satisfied for a longer period. This combination of reduced hunger and prolonged fullness makes it much easier to eat less food and, as a result, lose weight. This dual action is what makes Ozempic so effective for many individuals. It is not simply a diet pill. It is a medication that works with your body's own systems to change how you process food and perceive hunger. It is prescribed to be used alongside a healthy diet and regular exercise, acting as a powerful aid rather than a replacement for a healthy lifestyle. This comprehensive approach is key to its success. Understanding this foundation is the first step in appreciating both the incredible potential and the necessary precautions that come with using this modern medicine. The most celebrated benefit of Ozempic is, without a doubt, significant weight loss. For many who have struggled for years with obesity and related health issues, this can be life-changing. Clinical studies have shown impressive results, with users losing a substantial amount of weight over several months. This is not just about fitting into smaller clothes. It is about reducing the strain on the body that excess weight causes. Alongside this, its primary purpose of controlling blood sugar in people with type 2 diabetes remains a core benefit, often lowering levels effectively without causing dangerously low blood sugar or hypoglycemia. Beyond these primary effects, emerging research from early 2025 has pointed to some remarkable and unexpected advantages. Studies have suggested that using semaglutide may offer protection for our most vital organs. The findings indicate a lower risk of serious cardiovascular events like heart attacks and strokes. Furthermore, the same research found a potential link to a reduced risk of neurological conditions, including Alzheimer's disease and other forms of dementia. This suggests that the benefits of this medication could extend far beyond the scales and blood glucose meters, potentially safeguarding our long-term health in profound ways. Another fascinating area of discovery is Ozempic's potential impact on addictive behaviors. Some people using the drug have reported that their cravings for things like alcohol, nicotine, and even junk food have diminished. Early studies support these anecdotal accounts, showing lower rates of addiction to substances like alcohol and cannabis among users. This has led scientists to explore whether the drug's influence on the brain's reward centers could be harnessed to treat addiction more broadly. While this research is still in its early stages, it opens up a very exciting possibility for tackling a wide range of compulsive behaviors. Finally, an unexpected side effect that has been widely reported is an increase in fertility. There have been numerous stories of Ozempic babies where women have become pregnant unexpectedly, even some who were using contraception or had previously faced fertility challenges. It is thought that weight loss can rebalance hormones and restart ovulation, while the drug might also affect how oral contraceptives are absorbed by the body. This has led to recommendations for women of childbearing age to be particularly mindful of contraception while using the medication, highlighting yet another powerful and perhaps surprising effect of this drug. While the benefits of Ozempic can be significant, it is equally important to be aware of the side effects. The most common issues are related to the digestive system, which is not surprising given how the drug works. About 1 in 10 people may experience nausea, vomiting, diarrhea, or constipation. These symptoms are often most noticeable when you first start the medication or when the dose is increased. For many, these effects are temporary and lessen as their body gets used to the drug. Some users also report unusual, sulfur-smelling burps, which are thought to be caused by the slowed digestion process. Beyond these frequent but generally manageable side effects, there are more serious risks to consider. One of the most talked about is gastroparesis, a condition where the stomach is essentially paralyzed and cannot empty itself properly. This can lead to severe, long-term nausea, vomiting, and abdominal pain. There have been reports of individuals being hospitalized due to these severe digestive complications. Additionally, there is an increased risk of developing pancreatitis, which is a painful inflammation of the pancreas, as well as gallbladder problems like gallstones. These conditions require immediate medical attention and underscore the importance of professional medical supervision. Another area of concern is the potential for vision complications, particularly for those with pre-existing diabetic retinopathy. This condition affects the blood vessels in the eye, and a rapid improvement in blood sugar control can sometimes make it temporarily worse. More recently, studies in 2024 and 2025 have explored a possible link between semaglutide and a rare condition called NAION, which causes sudden and often permanent vision loss. While the connection is still being investigated and cases are rare, any change in vision while using Ozempic should be reported to a doctor immediately to be safe. Finally, there are other noteworthy risks that require caution. The drug carries a warning about a potential risk of a specific type of thyroid cancer, known as medullary thyroid carcinoma. While this has mainly been observed in animal studies, it is a risk that cannot be ignored. Furthermore, some recent studies have noted a higher incidence of arthritic disorders among users. These serious potential outcomes are not meant to cause alarm, but to emphasize that Ozempic is a powerful medication. It is not a simple lifestyle drug and should only be used under the careful guidance of a healthcare professional who can weigh the benefits against these risks for you. Given the potent effects of Ozempic, using it safely is paramount. The best way to manage potential side effects is to start with a very low dose and increase it gradually over several weeks or months. This start low, go slow approach allows your body to adapt to the medication, which can significantly reduce the intensity of common digestive issues like nausea. A typical starting dose is just 0.25 milligrams per week, slowly building up to the effective maintenance dose. This careful process, guided by your doctor, is the single most important step in having a positive experience with the treatment. Regular medical checkups are absolutely essential when you are on Ozempic. These appointments allow your doctor to monitor your progress, check for any adverse effects, and make adjustments to your treatment plan as needed. For those with diabetes, regular eye exams are crucial to catch any changes related to diabetic retinopathy early on. It is also vital to stay well hydrated, as drinking plenty of water can help prevent dehydration caused by vomiting or diarrhea, which in turn protects your kidneys from potential injury. Simple measures like this can make a huge difference in your overall safety and well-being. There are also simple lifestyle adjustments that can help manage the day-to-day side effects. If you feel nauseous, eating small, bland meals can help. Foods like crackers or sipping on ginger or mint tea can be quite soothing for an unsettled stomach. Because of the potential for increased fertility, women who do not wish to become pregnant should use effective contraception. It is a good idea to discuss contraceptive options with your doctor, as the drug might reduce the effectiveness of oral pills due to its effect on stomach emptying. Being proactive about these details is part of using the medicine responsibly. In conclusion, Ozempic is a remarkable medical tool with the potential to bring about profound health benefits, from weight loss and diabetes control to protecting the heart and brain. However, it is not a risk-free solution. It is a powerful prescription drug that comes with a range of side effects, some of which can be serious. The key is to approach it with caution and respect. Always talk to your doctor to understand if it is the right choice for you, and ensure you get it from a reputable source. By working closely with a healthcare professional, you can safely navigate the journey and harness its benefits while minimizing the risks.